welcome back to the Nursing Genre YouTube channel. So in this video, we're going to discuss about the condition called melanoma, which is a skin condition we can see in this picture. So this is a skin condition. Let's know about this condition in detail. So first of all, definition. Melanoma is a type of skin cancer that occurs when pigment producing cells called melanocytes. So what here they are saying means we have the a type of cells called melanocytes. So these cells are the skin pigment cells. That means these melanocytes gives the skin its color. So what these melanocytes do means they just give the skin color in normal conditions. While in melanoma, what they do means they mutate and begin to divide uncontrollably. So they will divide uncontrollably. So melanoma can develop anywhere on the body in those with light skin. So it can develop in anywhere on the body. For people with fair skin, it may develop on the chest and back in males, the legs in females, neck and face. So usually it develops on these areas. However, it can also occur in the eyes, nose, mouth, throat, genital or anal areas. We can see the causes but there is no exact cause of melanoma. The research is still going on. However, scientists do know that people with certain skin types are more prone to developing a melanoma. So certain skin type people, they have higher chances of getting this melanoma, while others do not have that. While others don't. Next one is risk factors. Factors that may increase the risk of melanoma include. Here they have given some risk factors. First one is a family history of melanoma. If your parents or grandparents have melanoma, you may have the chance of getting this melanoma. History of sunburn, exposure to UV light, having many moles or moles that are difficult. Usually, everybody have moles, whereas if a person got many moles or moles that are in usual, so you may have the chance of developing melanoma. And also living closer to the equator or at a higher elevation. That means the people who are living closer to the equator, so they are getting much exposure to the sun, so they also have this chance of getting melanoma. Skin that sunburns easily, that means skin that is very sensitive to light. And next one is weakened immune system. Those who are not immunized or they who doesn't have much immunity to fight against the diseases, those who also have the chance to getting this melanoma. Next one is types of melanoma. There are 4 major types. So we can see here the red highlighted ones. Superficial spreading melanoma, nodular melanoma. Third one is lentigo malignant melanoma. Fourth one is acral lentiginous melanoma. So the first one, superficial spreading melanoma, it is the most common type. And also it is usually flat and irregular in shape and color with different shades of black and brown. It is most common in fair skin people. So superficial spreading melanoma, we can see this melanoma in fair skin people, and it is the most common type. And also it is flat. It is not raised, it is flat. And also it is an irregular shape. It doesn't have any particular shape or any particular color. It has the shades of black and brown. We can see the second one, nodular melanoma, whereas it starts as raised area. Whereas in superficial spreading melanoma, we can see flat areas. In here, we can see raised areas. That too, it is dark blackish blue or bluish red in color. Some does not have any color. So this is about the nodular melanoma, which is quite different from superficial spreading melanoma. Third one is lentigo malignant melanoma. It usually occurs in older people. It is most common in sun damaged skin on the face, neck and arms. So mostly, we will be exposed. Mostly, the exposed areas will be face, neck and arms. So the sun damage, it is occurring on the sun damaged areas like these common areas. And also the abnormal skin areas are usually, so where is the affected place will be, affected tissue or affected skin will be like large, flat and tan with areas of brown. It is brown in color and also it is flat, not raised. And also it shows shades of brown and it is large in size. And also the fourth one, acral lentiginous melanoma. It is the least common form. It usually occurs on the palms, soles or under the nails. That means it is quite different from the above 3 because it is occurring on the very So it is occurring on the very different sites, like unique sites like palm soles or under the nails. So these are the 4 types of melanoma. Superficial spreading melanoma is flat and it has shades of black and brown, and it is flat. In nodular melanoma, it is raised and it is the color of blackish blue or bluish red. Next one is melanoma. So here we can see see this thing in older people. It has the shades of brown. It usually affected on the face, neck and arms. Whereas in acral lentiginous melanoma, it's quite different from melanoma. Here we can see the affected skin on the palms, soles or under the nails. Next one, clinical features. The first one is any skin changes such as a new spot or mole or a change in the color, shape or size of an existing spot or mole. So usually any mole changes on your skin may be a sign, and a skin sore that failed to heal. So a sore that does not heal is maybe a sign. A spot or sore that becomes painful, itchy or tender to touch. And also a sore that starts to bleed. A spot or lump that looks shiny, waxy, smooth or pale. A fire lump that bleeds or look ulcerated or crusty. So usually our skin is intact. Whereas in this melanoma condition, it looks ulcerated or crusty. And also a flat inflamed spot that is rough, dry or scaly. It usually dry, shiny, waxy, and it looks ulcerated or crusty. A sore that starts to bleed, that does not heal, and also it is tender to touch and it is painful. So these and all changes or these and all signs we can see in this melanoma condition. Next is screening. How can we detect this melanoma by ourselves? Means we can observe these 5 things during observation or during screening. The abcde examination of moles is an important method for revealing potentially cancerous lesions. It describes 5 characteristics to check for in a mole that can help a person either confirm or rule out melanoma. The first character is asymmetric. If the mole is asymmetric, that is not symmetrical. So what happens? Usually our moles are round and they are symmetrical in shape, whereas the cancerous moles looks different to other side. And the next one is border. Next character is border. This is likely to be irregular rather than smooth and may appear rather notched or blurred. So this border looks irregular and also it is ragged, notched or blurred. Third one is color. Melanomas tend to contain uneven shades and colors including red, black, brown and tan. They even contain white or blue pigmentation. Color means here they are saying like usually our walls contains only the single color, or maybe the color a mixture color of the red or the dark brown like that. Whereas in melanomas, they even contain colors. In a single mole, we can see different colors like red, black, brown or tan. We can see these 4 colors in a single mole. So that's how we can recognize melanoma. Next one is diameter. So in melanoma, the mole size increases in its diameter. Larger than 6 millimeter indicates melanoma, not melanoma. It might be cancerous. Next one is evolving. So this mole's appearance changes weekly or monthly. So it looks cancerous initially. So we can see here abcde examination. ABCDE, first one is asymmetry. So in normal conditions, if a mole we can see on the body, it looked like this. Whereas in melanoma, here we can see it looks asymmetrical. It does not have any regular shape. Whereas in the border, here in normal moles, we can see a regular border and it is quite in shape and quite in line. Whereas in melanoma, we can see uneven borders. It does not have any boundary limits. Next one is color. Here we can see only single color. In a mole, in a normal regular mole, we can see a single color. Whereas in melanoma, we can see multiple colors in a single mole. Next one is diameter. So it is this diameter does not changes. Whereas in melanoma, it will change. Like it is greater than 6 millimeters like that. Here we can see how a melanoma transforms, how a cells transforms into melanoma. So here it is the birthmark. Next one is mole. Next one is papilloma. The 4th one is melanoma. Here this is the cancerous condition. we can see on the skin. Next one is staging. So as this melanoma is a cancerous condition of the skin, so every cancer has a staging. So this cancer also has stages of 4 stages. So this includes 5 stage from 0 to 4. So in stage 0, melanoma in situ we can see. That means the cancer is only present on the outermost layer of the skin. In stage 1, so the cancer is up to only 2 millimeters thick and it does not spread to the lymph nodes and it is not ulcerated. Next one, stage 2, in this the thickness of the cancer, it is up to 1 millimeter to 4 millimeters and it may be ulcerated and may spread to lymph nodes also. In stage 3, it may or may not spread to, it may spread to lymph nodes, maybe it also spreads to lymphatic channels. In stage 4, but here it can be any thickness and also be ulcerated, the skin and the original cancer no longer be visible, and also that develops the near primary tumor. In stage 4, it is usually in the stage 4 we call it as metastasis. That means the cancer invades to the other organs or distant tissues like that. Here we can see the cancer has spread to the distant lymph nodes or organs such as the brain, lungs or liver. The tumor may or may not be ulcerated. Which is diagnosis? How can we diagnose? This is melanoma. So usually the dermatologist inspects the size, shape, color and texture of our walls. That is the first one. In next one, they may take the piece of the growing our walls and they'll send it for the lab to see under the microscope or to examine in the microscope. This whole process we call it as skin biopsy. Next one, it is called sentinel lymph node biopsy. That means we'll see the cancerous tissue or cancer, whether it has spread to nearby lymph nodes or not, like that. Next one is CT scans or X-rays. It may be done to diagnose the melanoma, whether it has spread to the distant organs or not, like that. We order CT scans or X-rays. This is how we can diagnose the melanoma. And next one is management. Usually surgery is mostly needed for the melanoma condition. So based on our staging and all, the doctors will provide us the treatment. The first one is chemotherapy. That means it's the first stage. That means it's the first priority that they use the medicines to kill the cancerous cells. Next one is immunotherapy. That means they use some particular medicine to boost our immunity to fight against the cancer. Next one is radiation treatments. That means they'll use the light therapies to kill the cancer cells. Next one is surgery. And next one, the final one is topical medicine. Then use this to boost our immune system. So how can we prevent this melanoma from occurrence? So the first and most important thing is to prevent the UV exposure. So we have to limit our sunlight exposure, especially in middays. The first one, what we can do to limit this UV exposure means, so we have to use wide-brimmed hats, sunglasses with UV protection, lightweight or long sleeve shirts, and also we have to be in the shade and we have to avoid tanning beds, and also we have to apply sunscreen on the tops of the feet, ears, and necks, the top of the head also. And also we have to apply the sunscreen before going out. That means 15 minutes prior to going out we have to apply sunscreen. Also we have to reapply this sunscreen for every 2 hours, and also we have to apply the lip balm that contains SPF 30 or higher. And also the doctors or dermatologists also recommend us to use the sunscreen that contains SPF of 30 or higher. Complications. What are the complications of this melanoma? If left untreated, it will spread to other parts of the body. And also the treatment of the melanoma can cause the side effects including pain, nausea, fatigue and etc. They may also cause. These are the complications of melanoma. So thanks for watching this video. If you find this video helpful, please do like, share, subscribe to this channel, The Nursing Genre. Thanks for watching once again. I hope you got the full knowledge about the melanoma. Thanks for watching. Thank you.